Hello everyone, this is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, Bapu Banarsidass College of Dental Sciences, Lucknow. Today's lecture is on pleomorphic adenoma and Warthin's tumor. Pleomorphic adenoma, it is called mixed tumor. It is most common salivary gland neoplasm. It is a benign neoplasm. It consists of cells which exhibit the ability to differentiate to epithelial cells and mesenchymal cells. Epithelial means ductal and non-ductal cells, and mesenchymal, chondroid, myxoid, and osseous. Most common site is parotid gland. It occurs more commonly in females, occurs at any age but mostly 30 to 60 years. It is usually unilateral. Clinical features, it is painless, slow-growing swelling, firm mass, initially in small size and then begins to increase in size. Initially, it is movable, but with continuous growth, it becomes more nodular and less movable. It is a recurrent tumor, multinodular, fixed on palpation. Palate intraorally is most common site for minor gland mixed tumors, and it is seldom ulcerated unless secondarily traumatized. Mostly occur in superficial lobe and present as swelling overlying the mandibular ramus in front of the ear. About 10% of parotid mixed tumors develop within deep lobe of the gland beneath the facial nerve. Histopath features, it is well circumscribed encapsulated tumor. Capsule may be incomplete or show infiltration by tumor cells. And it is characterized by variable, diverse structural and histologic patterns. Mostly, it demonstrates glandular epithelium and myoepithelial cells within a mesenchyme-like background. So epithelium shows ducts and cystic structures, as you can see in the picture, and may occur as island or sheets of cells, anastomosing cords, and foci of keratinizing squamous cells and mucus-producing cells. And the cells contain moderate amount of cytoplasm. Mitosis is rare. Stromal or mesenchymal component attributable to myoepithelial cells. So you should remember that myoepithelial cells are the major component of pleomorphic adenoma. There is variable morphology, sometimes appearing as angular or spindled. Some myoepithelial cells are round with eccentric nucleus resembling the plasma cells. So there is vacuolar degeneration of myoepithelial cells that can produce a chondroid appearance. Most tumors show chondroid differentiation. Chondroid means cartilaginous. So these are highly characteristic stromal changes that are believed to be produced by these myoepithelial cells. There is extensive accumulation of mucoid material that may occur between the tumor cells, which results in myxomatous background. The stroma exhibit areas of eosinophilic hyalinized change, fat or osteoid is seen. Osseous metaplasia, not uncommon. Occasionally, salivary tumors composed almost entirely of myoepithelial cells with no ductal cells. Such tumors often called myoepitheliomas. Then there is Warthin's tumor. Other name is very important. It is also called papillary cyst adenoma lymphomatosum. It is second most common benign parotid tumor. 5 to 14% of parotid neoplasms. The pathogenesis is uncertain and it is believed to arise from heterotrophic salivary gland tissue found within the parotid lymph nodes or proliferation of salivary gland ductal epithelium that is associated with secondary formation of lymphoid tissue. So risk factors, smokers have 8-fold greater risk. Clinical features, almost restricted to parotid gland. They appear painless, slow-growing nodular mass of parotid gland. Palpation, we can see it is firm or fluctuant. The common site is tail of the parotid. Unique characteristic is it occurs bilaterally and rare in submandibular lingual glands. We can see in older patients and in males, it is mostly seen. Male to female ratio is 10:1. It is seen in 6 to 7 decade of life. And it is associated with cigarette smoking also. Histopath features, we can see mixed ductal epithelium with lymphoid stroma. In the picture also, you can see this is the epithelium and it is double layer. Oncocytic in nature, forming uniform rows of cells surrounding the cystic spaces. And these cells have abundant, finely granular eosinophilic cytoplasm and are arranged in two layers. So this picture is of low power view and this one is the high power view. So you can see the double layer in this picture and you can also see lymphoid stroma. So inner luminal cells are tall columnar, centrally placed, palisaded, hyperchromatic nuclei. And the second layer is cuboidal or polygonal cells with more vesicular nuclei. Lining epithelium demonstrate papillary enfoldings that protrude into the cystic spaces surrounded by lymphoid stroma. Then there are focal areas of squamous metaplasia or mucous cell prosoplasia may be seen. The epithelium is surrounded by lymphoid stroma that frequently shows germinal center formation. So that is all for your lecture. Thank you.